Okay. Now let's talk a little bit more about a chronic sprained ankle. Now you may have a couple different situations with the chronic sprained ankle. One of the situations is that the ligament are lax, so the joint will be hypermobile. Okay, that's too much, hypermobile. So in a hypermobile ankle, you're much more susceptible to spraining it again. Okay. So in this situation, I'm really not going to do anything with the ligaments unless I feel any kind of buildup, any kind of tissue abnormalities. But in this situation, the ankle is lax, so if I'm working these ligaments, I don't want to make them even more lax. So in this situation, we would just work on strengthening, okay? Strengthening the muscles that cross the ankle to give the ankle more stability. Okay? Now let's talk about a chronically sprained ankle that has fibrous tissue or fibrotic tissue. Okay? This situation, the ankle may be hypomobile and have less mobility. Okay? So in this situation, they may have scar tissue that's formed around here. They may have scar tissue, a lot of scar tissue form in this area. You may have fibrotic tissue that is a result of inflammation not being resolved, and that tissue is very, very hard. Okay? Very, very hard. Depending on how long it's been there, you may not even be able to make any kind of therapeutic change to it. Okay? But we can actually work in this situation as far as a condition management type situation to give them some temporary mobility in the ankle. So maybe we can change the way they move, give them a little bit better gait for a short period of time. But that's a situation that you're going to have to keep working with that client, and you may not even be able to resolve any of that fibrous tissue, okay, or fibrotic tissue. So let's just say we had an ankle sprain where they didn't do any kind of treatment whatsoever. No rice, no massage, nothing. They didn't do any kind of exercises, whether it's just range of motion exercises or strengthening exercises. They just sprained it, raised it up. When they were able to walk again, they just started walking. And in that situation, they probably weren't walking properly. Okay? So in this situation, what I actually do, if we have the fibrotic tissue in this area right here, due to the inflammation that wasn't resolved, I will actually go in there and friction that tissue. Now, Monica doesn't have any of that, obviously, so we're going to kind of pretend, okay, in this situation. Now, sometimes this tissue can be very, very painful. Okay, so what I actually will do is I will do a little bit of ice massage. I know, just a little bit, maybe about three minutes or so with an ice cup, just to give that a little bit of numbing to the area, not too much, because we still want them to have some kind of sensation while we're doing this treatment. And then it will allow me to get a little bit deeper into that tissue. And I'm not going to get really super deep on Monica because she doesn't have this issue, and we don't want to give her any kind of soreness for today or tomorrow. Okay? You can use a braced finger for this. You can get in there and use a thumb. Again, I need to go lighter. Crunching her tendons, I don't want to do that. So we would move all around that fibrotic tissue. Whether the fibrotic tissue can go all the way down into this area, you would thoroughly work all of that fibrotic tissue. Again, depending on how long that's been there, is going to determine your results. Okay, if it's been there for a long time, sorry about that, then the chances are probably nil that you're going to make any kind of therapeutic change. Okay, just going to have to stay in our condition management mode, make some temporary changes, give them a little bit more mobility, just even for a short period of time. Again, in this situation, I would work below and above the joint, addressing all the muscles that we did before. I would take it through some range of motion movements. Even into inversion. Eversion. And I would follow this all up with some nice, long, relaxing strokes. Some compression. Again. Nice strokes. And that's the end of our treatment. I would actually do this treatment probably a couple times a week. If it's an acute situation, I may only do it one time per week, depending on how my client or patient is responding to the treatment. Now again, this is my treatment for sprained ankle. Is it going to be the same for everybody? No. Okay, everybody is different. The way they respond to your treatment is different. You may have to change the amount of time that you're working on the ligaments. You may have to adjust the pressure, because obviously Monica's ankle is going to be different than, say, one of our football players. You're going to have to just modify your treatment according to your patient or client. This is the way that I work ankles. It's not the only way to work ankles, but I've had I've had some really good success doing this. Okay. That concludes our treatment for the day. Thank you. Hope to see you next week.